You will gain access into the vertebral body using an access needle. Drill to the anterior 1/3 to create a channel for the balloon. Next, repeat the previous steps in order to gain access in the other pedicle. Insert the balloons. Inflate the balloons to create a void. Next, deflate and remove the balloons. Then, insert the bone fillers and inject the cement. Once the cement fill is finished, remove the bone fillers and access cannula. With bipedicular vertebral augmentation procedures, the optimal trajectory will be medial enough so that both balloons will be touching. You will want to take the following pathway. With this placement, the balloons will span the width of the anterior portion of the vertebral body. The needle will be placed to the posterior 1/3 of the vertebral body. As you approach the medial border of the pedicle, check the lateral image to be sure you are past the posterior border of the vertebral body. The cardinal rule when placing a needle is to respect the medial border of the pedicle being accessed, because you do not want to breach the spinal canal. If the needle placement is too lateral, the balloons will not be touching and there will be an uneven distribution of cement. Depending on the physician's preference and characteristics of the fracture, he or she has the option of treating with a unipedicular approach. With a unipedicular balloon vertebral augmentation procedure, the optimal trajectory will be medial enough so the balloon will be in the midline of the vertebral body. If the needle placement is too lateral, there will be an uneven distribution of the void, which will lead to an uneven cement fill. Begin the procedure by squaring off the end plates in the AP view. You know you are in the perfect AP when the end plates are squared off. The pedicles are in the upper right and left corners, and the spinous process is centered in the vertebral body. Once confirmed that you have optimal needle placement, continue to advance the needle to the posterior 1/3 of the vertebral body. Next, repeat the previous steps in order to gain access to the other pedicle. Then, use the hand drill to drill to the anterior 1/3 of the vertebral body. Once both needles are placed and drilling is done, insert the balloon down the access needle. There are radiopaque markers at the distal tip of the balloon as well as the proximal end of the balloon to show where the balloon is placed. Make sure the proximal radiopaque marker is completely out of the access cannula before inflating. Once placed, inflate the balloons. Watch the pressure gauge and inflator markings to be sure you do not exceed maximum pressure or volume. After a void has been created, it's time to inject cement. There are two methods to injecting cement. One method is hand obturation, in which multiple bone fillers are filled with cement and hand injected into the vertebral body. Physicians might choose to perform hand obturation because they prefer the tactile feel, or they can achieve a precise cement fill. To perform hand obturation, fill multiple bone fillers. Once filled, insert the bone filler into the access cannula. Insert the stylet down the bone filler to hand obturate the cement into the vertebral body. Continue to reload the bone fillers into the access cannula as needed. Physician preference determines when the cement injection is finished. The second method is direct injection, in which a device is used to inject the cement. While staying in the lateral, slowly begin to inject cement. Continuously take pictures or use live fluoro to keep an eye on the flow of cement. It's critical to make sure the cement does not flow outside of the vertebral body or flow back toward the spinal canal. Physician preference determines when the cement injection is finished. Perform a final check before removing the access needles. Insert the stylet of the cannula and slowly pull back the access cannula while checking imaging to make sure cement isn't trailing with the needle.